Okay, good afternoon. My name is Quirijn de Mast. I'm an internist, infectious diseases specialist working in Radboud University Medical Center in Nijmegen in the Netherlands. Thank you very much for the invitation. In this talk, I will discuss platelets in tropical infections. And it's very interesting, platelets in tropical infections, because many tropical infections are associated with a pronounced thrombocytopenia. And this concerns both viral infections like dengue, yellow fever, Lassa fever, but also Ebola, hantavirus, Crimean Congo virus, but also like in an acute HIV infection, thrombocytopenia is often seen. But also in some bacterial infections that are common in the tropics, like leptospirosis, rickettsia infections, typhoid, thrombocytopenia is common. And last, thrombocytopenia is frequently seen in malaria and some other parasitic infections. For the current presentation, I will focus on one viral infection, it's called dengue, on one bacterial infection, leptospirosis, and on malaria. And as I will show, it's not only thrombocytopenia, but these infections are also associated with changes in the function of platelets, which I think are just as important and maybe even more important than just a decrease in the number of platelets. As you may know, infections and platelets, they have a mutual relationship. And over the past decade, more and more has become known regarding the role of platelets on the pathophysiology of infections. We have many more platelets than needed for hemostasis, and we now know that platelets are important in host defense. Platelets can recognize all types of microorganisms, can bind them, and then release proteins which are important for host defense and which can also kill, for example, microorganisms. And this also applies to tropical infections. And one important example of this is the role of platelets in the killing of malaria parasites within red blood cells, which was published now over 10 years ago in Science. But for this presentation, I will focus on the effects of infections on the number and especially the function of platelets. And as said, I will start with a viral infection called dengue. And dengue is the most common arboviral infection. So arboviral means it's being transmitted by mosquitoes. And about half of the world population is living in areas at risk for dengue. More than 110 endemic countries, almost 400 million infections a year, and which is a huge increase over the past 50 years. The World Health Organization also named dengue as one of the top 10 threats to global health in 2019. This is before the COVID pandemic. But this just underlines the fact that dengue is a really important infection globally. So dengue infection. So most of the dengue infections are asymptomatic. Of the ones that are symptomatic, dengue is usually a viral infection, a flu-like infection with fever, headache, myalgia, and erythema. A minority of dengue infections follows a complicated course, and the most important complications are bleeding and a transient plasma leakage syndrome, whereby the endothelial integrity is compromised, and that can even lead to shock. The cause of dengue is quite special if you look at other infections. Namely, it's characterized first by a phase with fever that lasts usually between 2 and 4 or 5 days. And when the fever goes down, that's the moment that we see the complications. It's called the critical phase. And that is usually preceded by a sharp decline in platelet number. As said, the most important complications of dengue are a transient plasma leakage syndrome and bleeding. And a lot of attention has been given to the role of disturbance of the endothelial lining. The endothelial lining is covered by a glycocalyx layer, which is being compromised during dengue. That's partly due to the effect of inflammatory cytokines, but could there be more? Could platelets itself also play a role in that? A review in the England Journal over 10 years ago focused on the important role of platelets in preserving the endothelial lining. Platelets produce all kinds of active substances which protect the endothelial lining. And if your platelet number is low or your platelets are dysfunctional, loss of these or decrease in these protective substances may increase plasma leakage. In dengue, we have measured several of these factors. For example, sphingosine 1-phosphate or angiopoietin 1. And as you can see in this figure, these proteins are indeed decreased during acute dengue. And that could contribute to plasma leakage, so directly linking thrombocytopenia to plasma leakage. But there is more. When I still remember when I first saw the first patients with dengue in Indonesia, what I found striking was that these patients, they had petechia and other bleeding manifestations. Well, they had thrombocytopenia, but the number of platelets was not that low that you would expect these bleeding manifestations. For example, they had 40 or 50 platelets, while usually you only see petechia when platelet numbers fall below 10. Also, I've done quite some malaria research. Petechia you almost never see in malaria, while the number of platelets is usually like the same as in dengue. So that brought up the question, could it be that normal platelet function is compromised in dengue? Also, because if you look at the bleeding pattern with mucosal bleeding, sometimes vaginal bleeding, and the skin bleeding, it's a bleeding pattern we know from patients with problems in the platelets, either number or function. So we looked at platelet reactivity to ex vivo stimulation, and we used flow cytometry for that. And in the past years, we have looked at several infectious diseases. Some of them are known are associated with thrombosis or increased risk for cardiovascular event, while others, like dengue, are associated with bleeding. And these are data from patients with dengue in Indonesia with flow cytometry. And what we did, we stimulated platelets with different platelet agonists, in this case TRAP, and we measured their reactivity by, in this case, p-selectin expression on the platelet membrane. And what you see is in the acute phases of dengue is that platelets do respond less, in the sense that they express less p-selectin when stimulated. And this fits thrombocytopathy, so reduced platelet reactivity. And I think that this could contribute to the bleeding manifestations in dengue. Other groups have found similar findings. For example, last year, a group from Rotterdam, also together with colleagues in Indonesia, using a different technique, so aggregometry, they found that people in the acute phases of dengue, that platelets respond less. and that's in response to different agonists like ADP, collagen, and TRAP. So in conclusion, dengue is an infection characterized not only by thrombocytopenia, but also thrombocytopathy. Then I switched to a bacterial infection called leptospirosis. Leptospirosis is a bacterial infection that occurs globally. It's caused by a spirochete, and you especially see it in areas with flooding. That has to do that these spirochetes are mainly transmitted by rodents, for example, mice or rats, and the spirochetes can be in the rat's urine. Leptospirosis usually causes a flu-like illness, and a proportion follows a complicated course. And this complicated course exists of organ failure. You can have kidney injury, you can have liver problems, but also thrombocytopenia and bleeding is quite common then. As you see here on these chest x-rays, lung bleeding is a feared complication which carries a high mortality, especially in low-income countries. So we were interested in the function of platelets because thrombocytopenia is quite common, but like severe thrombocytopenia is uncommon. So many patients develop bleeding with still relatively high platelet numbers, between 50 and 100. And what we found, so we used again flow cytometry, is quite similar to what we found in dengue. That is, patients with leptospirosis, and especially the ones with bleeding complications, they had compromised platelet function, so reduced platelet reactivity to ex vivo activation. You may ask, like, is that specific for leptospirosis, or is this something you can also see in common bacterial infections? And I think it is specific for leptospirosis because we also studied platelet reactivity in patients with bacteremia here in the Netherlands, patients with gram-positive bacteremia, like for example Staphylococcus aureus or streptococcal bacteremia, and patients with gram-negative bacteremia, and mainly Escherichia coli. And what we saw in these people that in those patients with gram-positive bacteremia, that platelet reactivity is increased. So last is a parasitic disease, malaria. As you know, malaria is still a huge global health problem. Around 450,000 deaths each year, especially young children. And thrombocytopenia is almost universal in malaria infections. And the etiology is still not well known. As an example, here in Nijmegen, we are one of the few places where we do controlled human malaria infections, that healthy volunteers are being exposed to malaria-infected mosquitoes, and they develop a malaria infection under fully controlled circumstances. We mainly use these infections for vaccine development and also to study the pathophysiology of malaria. And what we see is that early during the course of the malaria infection, you see a decrease in platelets. But in contrast to dengue or leptospirosis, bleeding manifestations are extremely rare in malaria. What is important in malaria is, again, the endothelium. But the endothelium here is important that malaria is a disease of red blood cells. Parasites infect red blood cells. And these red blood cells, they stick to the endothelium, which leads to obstruction of the microcirculation. That is what you see here in this figure on the left. You see here capillaries, and in the capillaries you see red blood cells, uninfected red blood cells, but also infected red blood cells containing a parasite, and these red blood cells, they stick to the endothelium. And that leads to organ problems, for example, cerebral malaria. And on the right, you see MRI images of a 14-month-old child with cerebral malaria, characterized by diffuse brain swelling. Malaria is a disease characterized by endothelial activation. And why it's important for the malaria itself that the endothelium is activated so the infected red blood cells can stick to the endothelium. That leads to release of von Willebrand factor, and von Willebrand factor leads to platelet adhesions. And these platelets are also important in the sense that they may mediate sequestration, have binding of infected red blood cells to the endothelium. So platelets do play an important role in the pathogenesis of malaria by facilitating the sequestration of infected red blood cells. So what about platelet function? As said, bleeding is not a common phenomenon in malaria. And this is also what we found, and we recently looked at that again, is if you look at these volunteers that are exposed to malaria under controlled circumstances, you see that von Willebrand factor plasma levels are increased, clearly increased, and that von Willebrand factor is also in an active, meaning platelet binding conformation. But if we look, for example, and here in this table show some data of platelet reactivity, again by flow cytometry, you see that platelets at the most are only mildly activated, but we do not see that their reactivity is increased. So in summary, I show data that thrombocytopenia is common in different tropical infections, but there are important differences in the function of platelets. With some of the infections like dengue, leptospirosis, which are associated with bleeding, in those infections, we also see disturbances in the function of platelets. While in others, for example, in malaria, normal platelet function is preserved. And that makes it also of interest to develop point-of-care platelet function tests that can be used in, for example, a disease like dengue. Nowadays, many doctors rely on platelet numbers to decide whether a patient needs to be hospitalized for close monitoring. Usually patients with platelet numbers below 70 are being hospitalized. But if we would have a point-of-care platelet function test that could add important information, because it's probably also platelet function that determines bleeding manifestations. And this is something we are now working on together with the colleagues from Synapse to look at point-of-care platelet function tests in a tropical disease like dengue. I would like to acknowledge some people that are my colleagues here in Radboud, but also the colleagues at Synapse and many colleagues in Indonesia with whom I do the dengue work. Thank you for your attention.